for the hearts. Um, I have some weird nostalgia for the sayings on the hearts. um, but I'm definitely with Angie on the chocolate. I'd eat a couple of the candy hearts if they were in front of me and I was hungry, but they're not really my thing.
The sayings have changed. I don't know if you've seen them recently, but they've gotten very texty. They're like text messages. It's weird.
Yeah, I think I have seen some. I have a teenager at home, so but he's a little past candy hearts, so
I'll go. I'm Val Hicks. I work in the Wicomico County Mobile Response Stabilization Service through Mobile Crisis Affiliated Sante. I'm the family peer. And I used to love those candy hearts until the Necco brand quit making them. And then they got nasty and I gave up on them. But I like the old school ones, not the newer ones.
I'll go next. So I'm Tiffany Eckstein Hartwig. I am the Bridge Program Coordinator for Harford County Department of Housing and Community Services. We provide resources and education for adolescents, teens through elementary through high school age. And I am definitely, I've never liked the candy hearts. I probably maybe had one my entire life. And I said, it tastes like chalk, or it reminded me of the old chewable Tylenol. And I said, no, thank you. So I'm definitely more of a chocolate person, but I do appreciate the little sayings. They're kind of cute, but if they could put them on chocolate, that's where I would be.
I can go next. Hi, everyone. I'm Morgana Finney. I'm the Director of Communications and Development at the Foundation Schools, serving kids in Montgomery and Prince George's counties. I am anti candy hearts. No particular reason other than what's already been shared. The flavor has not been improved in its entire history, so I avoid it every year.
I'll go. Good morning, everyone. I'm Meredith Miller. I'm the mental health coordinator for Wicomico County Public Schools, and I am not Team Hearts, along with several other people. I don't like the taste of them. As someone stated, it's kind of a chalky taste.
Hi, I'm Audra Shabani. I'm with Midshore Behavioral Health, the local core service agency for the 5 Midshore counties. And yeah, no, that's a big no. I didn't know anybody really ate them. I thought you gave them to people, but you didn't eat them. So yeah.
Oh my gosh. I am so disappointed.
Heidi, send me chocolate any day. I'm good.
Well, you know, I'm not going to turn down chocolate. I know I have chocolate before I will have the candy hearts, but
absolutely
there's nothing about them.
No. I'm with everybody else. Actually, they remind me of Tums, you know, the chewable chalky Tums, and they've made them better by making those chewy things now. So why can't they make the hearts better? I mean, come on, somebody's got to do it. So anyway, I'm going to go back off screen and finish eating lunch between me. It's back-to-back meetings, so, but glad to be here.
I'll go next. I'm Renee Everett Sanzoni, and I'm with the Parents Place of Maryland, which is Maryland's Special Education and Health Information Service. So we serve the state of Maryland, serve the families for the state of Maryland, and it's all children who have disabilities, suspected disabilities, special health care needs, including mental health, obviously, birth to 26. And I am so sorry. Yeah, no, not the candied hearts. I'm like, yes, like everyone else, share the nostalgia of the messages, you know, and when you were in elementary school and you had to do the little Valentine's Day and you gave everybody a box. I'm probably dating myself now. But I am definitely team chocolate all the way.
I'm Laura Crovo. I'm with Grassroots Crisis Intervention in Howard County. So we provide crisis support to anyone, but also to kids who need mental health, substance use, any kind of crisis support. We also operate the emergency shelter in Howard County. Not a big fan of the conversation hearts. Sorry.
I'm glad we didn't do a poll on this one because it would be like Heidi and I and everybody else. Is there anybody else who hasn't had an opportunity to introduce themselves? Please hop on.
I'll go really quick. Christine Janice. I work out of the University of Maryland Center for Early Childhood Education and Intervention. I coordinate their early childhood apprenticeship program, helping parents mostly become preschool teachers. So excited to hear about this initiative and see how I can apply it to this work. Thanks. Oh, candy hearts. I think they're really pretty. So I think that they have a place in the world, but I would definitely like a box of chocolates.
My name is Jessica Janice Grimes. I am one of the lead school social workers at for Cecil County Public Schools. And I am the chair of our Children's Mental Health Matters Committee, where we've been trying to do community events for the past couple of years. So we have our second annual is going to happen this year. And I love the idea of the candy hearts, but I don't like to eat them.
Hi,
I'm
everyone. My
happy to
name's-
go.
oh.
Oh, I'm sorry, April, go ahead.
Hello, everyone. My name's April Adams. I'm a certified family peer support specialist with Maryland Coalition of Families, and we support youth with behavioral and mental health challenges. And I am not a fan of the hearts either. I love doing crafts with the idea of the heart, but I don't want to eat them.
Hi, everyone. So my name is Tracy Summer. I am with a program called MAX, the Maryland.
You muted, Tracy.
Oh, I'm
Oh.
sorry about that. I'm here kind of in place of our program director, Kelly Coble. She could not make it, but we are a support service to any prescriber and their healthcare team across the state with any question if they have been treating their patients with any substance use disorder or questions about pain management. So we are certainly happy to be here to support. And I will say I am not a fan of the candy hearts. I think that they are cute and great for kids and crafts, but I am also team chocolate.
Hey, everybody. My name is Erica Mendez. Excuse me. I am a clinical social worker for Prince George's County Public Schools. I am here on behalf of my sorority, which is the Rho Eta Zeta chapter of Zeta Phi Beta Sorority Incorporated. So we love serving the community and pushing out programs, initiatives for our families in Anne Arundel County. And yes, I am going to choose violence apparently by saying I hate those nasty little chalky tasting hearts. My kids enjoy them. Yay, eat them all. I do not like them. Happy to be here.
How do you really feel about them, Erica?
Don't hold back.
I'm Katie Klein. I am the infants and toddlers liaison for Somerset County. So I work with the babies through 3-year-olds. I am here. Angie and I took some classes together. So I'm here to kind of see how I can help kind of push this message forward. And candy hearts, no. Chocolate, I'm not even like diehard. I'd have ice cream if I could have any of that. So I'm kind of just different all around.
Hi, my name is Carrie, and I'm actually the intern for Tiffany. She introduced herself earlier, but the Harford County Bridge Program and the Office of Housing and Community Services. And I'm also team not candy hearts, but I do love a piece of chocolate. And I think the messages are cute. So I'm definitely on the put the messages on chocolate train.
Okay, is there anyone who has not had an opportunity to introduce themselves that would like? As you see, Neil Bankenstein has popped into the chat. So if anybody else is busy and would like to just pop in the chat, that would be fantastic. And just share the information that we've been sharing here. All right, well, thank you all for sharing. We really appreciate it. It sounds like candy hearts are just like me and Heidi and like maybe one other person. And also it doesn't have to be versus chocolate. Like if you're going up against chocolate, of course it's gonna lose. I feel that, but because everything loses against chocolate. All right, so as you all know, this is our rally kickoff for the Children's Mental Health Matters campaign. So a little bit about the campaign. For more than 20 years, we've brought together partners, schools, nonprofits, other agencies, and these are our goals for the campaign. We want to increase public awareness of the importance of children's mental health and substance use. We want to reduce stigma around mental health. We want to connect children and families with resources for prevention and support of mental health disorders. We want to highlight creative and innovative efforts of local communities in Maryland. That is like a huge piece of why we are here today, is to think of some creative and innovative efforts across the state to promote all of these goals. And we provide opportunities for all campaign partners and champions to be a role model. So I'm sure a lot of you have been involved in the campaign previously. Some of you might be new here. So I have a little poll that I'm launching now that should pop up on your screen, and we are taking a vote. So this is my first year, second or third, or you've been a champion for more than 3 years. Just to see sort of where our depth of knowledge goes. We are 100% answered, so I'm amazed. Everyone participated. Thank you. I'm gonna end the poll. So I don't know if I end the poll, if it, yes, I can pop the goals into the chat. Thank you for asking. Actually, Angie, can you pop the goals in the chat? Thank you. Everybody answered on the poll. So we have 40% say it's their first year. I don't know if you guys can see the actual poll things on there. And 20% it's your second or third, and then 40% is more than 3 years. Oh, yes, I can share results. I'm going to do that now. So that's great because we have an equal amount of people who are brand new to people who have been here for quite a while, and then a couple of folks who have sort of been here for 2 or 3 years. So that's amazing. It's like a great mix of new ideas and lots of experience. Awesome. Okay, so if you have been here more than 3 years, if you could pop in the chat how long you have been here, a partner. Only those folks that have been for more than 3 years. Heidi doesn't count for the purposes of this. But we applaud that you've been here for 20 years. All right, it's looking like Audra is winning so far, 14 years. That's incredible.
I just
Does
have to say
anybody?
that Audra happens to be a champion because she worked with me. So Audra still counts.
Hey, wait a minute, hold it. I ran the campaigns. Never.
You did. You absolutely did. That's right.
Not only was I the champion, I was the
You were.
in the campaign. So yeah, I do get the senior leadership there.
I forgot about that.
Yeah. Hello.
Well, we're so happy to have you. That's an amazing amount of knowledge. That's really, really exciting. And because you are our longest standing champion, if nobody else can chime in with more than 14 years, Heidi, keep your hand down. Audra. So Audra, we are going to send you something from our brand new champion store. So we have set up a store. We're going to share the link. I don't know if we're going to share it now or later. But you guys will get a link to our Champion store where you can go ahead and purchase items at a discount. So Champions get a discount in the Champion store. You could purchase hoodies like the one I'm wearing. For Children's Mental Health Matters, you can purchase notebooks. We have all sorts of things, baby onesies, just a whole bunch of really cool stuff that you may want to rep in the month of May or all year round. And Audra, we will be sending you that black bag that you see in the image, which is also available to purchase on our website. Angie, do you know how much the of a discount the Champions get? I think it's 10% maybe. I don't know if you actually
I
figured
can
it out.
tell you because I helped do it, but it's really, it depends because the price point on so many things were really all over the place. So it's probably at between what 20 and 30%. All of the Champions cost is about 1% over. While the other ones range from 1 to 30%, depending on the price. So, it's really at cost. If you're a champion, your link is going to be at cost, while non-champions do not get that at cost.
And I
Great,
will
thank
be dropping the link to the store later, but right now we're just teasing you with the bag.
Good point, good point. And we're also going to be sending out a little follow-up email that will include the link as well. So if you don't grab anything off of the screen while we're presenting, don't worry about it. We will also probably be sending out the video recording of this meeting. So everybody will have all of the same info starting. Because we have a great number of champions. I'm glad that all of you could be here, but this is just a small representation of how many people we have signed up already, which is great. So those of you who have been here for a little bit, have done the campaign once or twice or 20 times before. Does anybody want to chime in with some of their experiences? Maybe some of the activities you've done in your community, so we can just spark some conversation and ideas around some cool and innovative things we can do to get our community excited about children's mental health.
So for Cecil County Public Schools, this is going to be my second year kind of running a committee that also has 3 subcommittees. We are doing like a primary school-based events throughout the week, as well as secondary for our middle school and high school. And the topics of the day, range from, positive thoughts to what is mental health, to mental wellness, and things that you can do. And in those subcommittees, we kind of have everything pretty much planned out for our teachers, for our staff to kind of spread the messages. So morning announcements, activities to do during the lunchtime, stuff like that. And then at the end of the week, we have a large community event where people from the school, so students, families, and just community members all come together, where we have different mental health and mental wellness vendors attend. This year we actually have Tom Coverly, who is an illusionist. He's going to kind of be like our headliner, and he talks about mental health, bullying, that sort of stuff, along with magic and illusions. So we're trying to get, more community members to attend, and it's at Elkton High School because it's right off of 95. So it's kind of an easy to get to place. But yeah, this is going to be our second year in a row kind of doing this bigger event for the Children's Mental Health Matters campaign.
That sounds incredible. Thank you.
I can go. In Wacomico County Public Schools, all of our schools do something different in each of the schools, kind of, along with the announcements, and they work with the phys ed and health teachers. They also are doing different events at lunchtime. Most of them have like a different activities where they spin the wheel, and they have a bunch of swag that they give away at lunchtime and are able to come out and pick up resources and play games and things like that. Several of our schools are having mental health fairs after school for families. A couple of our feeder schools are having mental health barbecues, as well as a mental health. One of our high schools is actually having a mental health field day. where they're gonna have like, basically like the younger kids have field day. They're bringing it to the high school level, but incorporating mental health with that. We're also having, this year's our second annual, mental health awareness family night event, where we have a lot of vendors that come down. We're hosting it this year at our Salisbury Park. Last year it was downtown Salisbury, but we're also partnering with the Erase the Stigma 5K walk and run. So we're having that with the band AMP, which is several bands that are all kids that play music. So they'll be playing, as well as we'll have Cascading Carlos. We have Funny Farm Petting Zoo that's coming. We have bounce houses. We have therapy dogs. Just a lot of fun activities for the kids. So this is the second year that we are doing it. But all of our schools really do a great job as far as I bring them together. Usually one time a month, and each school, this year we have a grant, and each school is allotted $500 to purchase items and things that they want to do for their school, different activities that they have planned out for the kids. So we are very fortunate to have that. We also have our community foundation has reached out to us to see how they can partner and provide more funding to us so they can do more, bring more awareness within our schools during that week and that month.
That sounds fantastic. Thank you. Both of those activities, like the idea of having like a headliner and an illusionist, having somebody that's like gonna grab people's attention and create this awesome event that people will want to come to, sounds amazing. And then Meredith, your variety of things going on sound like it's like a really great family-friendly activities and day to spend out with everyone, with some really awesome ideas on how to get people engaged. So that's amazing. Does anybody else have cool events they've done previously or something they might be planning for the month of May? Okay, does anybody have an event that they are considering doing but might need a little bit of feedback or a little bit of support in doing so? And you may not have anything on your agenda just yet, but you may have something coming up as we start moving towards May. That's when, since that's Mental Health Awareness Month, that is where most of our activities usually happen, and during Children's Mental Health Matters Week and all of those pieces. So a lot of people hold their events until then. It's also warm out. But of course, we welcome events all year. We also welcome tabling. If your local community is having something going on, if there's a library near you that's having a day of tables, or a nonprofit or a school, if there's back to school night, those types of things, those are great opportunities to get in there. We will talk a little bit later, but we now have a supply order form. So if you are interested in getting supplies, you are going to be tabling at an event, you fill out the form, let us know. We will send you some pencils, some stickers. Oh, Angie just dropped it in the chat. Thank you. We will send you pencils and stickers and fake tattoos and all sorts of cool things that you can use to table at your event, as well as like one-pagers that explain sort of what the campaign is, flyers to get people's attention, that sort of stuff. As champions, you are committing to join us for the year. You are also committing to do one event or activity, something along those lines, which can be as simple as changing your email signature. Not everything has to be a large tabling event. I mean, those are wonderful. We are so excited for those. That's really how we get the word out. But also we recognize that people don't always have time or capacity for those types of things. So sending out our flyer to get people interested and sign up as champions is one way to do it. Changing your signature is another way. If you're with a family, I mean, you can sit down with your own kids and do some of the activities out of our toolkit, and those count. All of those are just spreading awareness and reducing mental health stigma, which is some of our largest goals. Speaking of, we have a bunch of items that we have pulled from our toolkit. We are updating our toolkit for this year, so we will have brand new fresh material in our toolkit. For those of you who have downloaded the digital toolkit before, it will be similar in style, but we will be expanding it quite a bit this year. So for now, though, we do have some activities that Angie is going to drop in the chat that you can try at home, that you can, excuse me, if you're in the schools or you're working with families, you can definitely implement some of them. Some are for little kids. We have a couple for high schoolers and older kids, which can be challenging to engage. We have one that is also in Spanish if you work with Spanish speaking families. So all of those will be things that you can utilize. We'll also be sending them in our follow-up email.
Yes, I'm working on that. Give me a second to get these in the chat, guys.
So Charlene, you said you're interested in hearing about events for champions that high turnout, especially among middle and high school students, which is perfect timing. So I was just talking about those high school kids being a little bit challenging to engage. Does anybody who has been working on the campaign for a little bit have any ideas on how to motivate that group?
So I just put in the chat, Kent County Public Schools over here does mental health, I forget what they call it, but anyway, Kent County is a small county. Let me just say that. I think they have 5,000 students total in the county. So, but at their middle and high school, they have all the students, they have an event during the day, all the students attend. And they did kind of like you had to go and ask. I call it a scavenger hunt. It would be fun to be more of a scavenger hunt, but you had to go and ask at each booth a question or something. And so we came up, they really had to engage. So before they could get any of our stuff, we asked them a question. What's one of your coping skills? What do you do when you're feeling anxious? To really engage them. And we had the best time. I so look forward to doing that event again, because to really get to talk to the students. And I also got to say to some of them who really had some answers is, wow, you're doing a great job with balancing your mental health, and you need to think about going into the field because we need people like you in the field. So yeah.
Oh, I love that. I love that they got feedback from you. Thank you for sharing. That's great. Does anybody else have any ideas on how to engage that super tricky, like 13 to 19-year-old crew? We do have some of those cool water bottle stickers. I don't know if that's still a thing. I know a couple of years ago that was such a thing. So we do have like the Children's Mental Health Matters ones. But we also have some you can get these giant packs from Amazon that have a bunch of.
Beware on Amazon.
Yes, we have to sort them. We have learned. You can't just mail those out.
And we're like, oh,
devastating.
Yes, yes,
Yes.
yeah. But they did love having stickers to pick up, and we did some kind of a squishy, because that way we could always tie it back into, okay, so if you're feeling anxious, can you use this? Some kind of squishy, even the hot cold packs, because they can be used hot or cold or just as a squishy as well. Just trying to think of what are some of the other things that we really engage with them. Oh, I'm totally drawing a blank.
Candy is a great option and cheap. You just put a bowl of candy at your table. That's often a great way to get folks to come by, particularly that age group.
I know that I don't think this was a campaign event, but I think it might be something that is possible in some communities. But there was a coffee shop here locally that did like a poetry slam that youth could come to and kind of just express themselves. It could be coordinated in some way as a mental health awareness event. If you obviously worded it in a way that youth will want to participate and share their feelings, it might be something that might engage them in some way to kind of do something like that.
I know our local library here in Cecil County kind of does a teen night periodically, and one of their things was around mental health and mental wellness, and I know that they had a really good turnout, and partnering with them kind of got a lot more teens involved in the things that we were kind of trying to talk to them about.
So I also want to say, just because we are regional, and so we have 5 counties we cover, we don't necessarily do things all in that week. We do the whole month, things throughout the month. So don't think that you have to squeeze everything into one week, because when we tried that years ago, we were dead at the end of a week.
Our goal is to make this year round, Audra. Like,
Right.
really, I would love for us to get to the point where, yeah, that week is great, but we're doing things all year long.
And we do that as well now because it also falls on Teacher Appreciation Week, which is really stressful for the schools to try to do both. Plus, they found that sometimes it doesn't get the recognition that they would like, the emphasis on Children's Mental Health Awareness Week. And then sometimes testing falls on that week. So some schools are doing it the week after the dedicated week. Some schools are actually starting at the end of April through that first week of May. So which is nice. It'll be kind of scattered throughout the month of May for all of our schools in our county. But yeah, they just every year it's like it always falls on Teacher Appreciation Week, and some of them try to tie in the teacher appreciation with the mental health piece of it, but I think for administrators sometimes it's just a lot going on. And so this year a lot of them have tried to just kind of like stretch it out and do different weeks and stuff, so it's not all within the same week.
That's a fantastic idea. So in our new toolkit, we're going to have it divided a little bit so that we have specific resources for educators, specific resources for communities and individuals, and then specific for like nonprofits and businesses. And then of course, once you get the toolkit, you'll have access to all of them just to take a look through. But because it'll be designated, you can open up the educators, and we have like scripts in there for those morning announcements, but those feel free to modify them and use them as you see fit for your school. So if you're doing them on a different week that's not Mental Health Awareness Week, then of course you can use the same scripts, just change it up a little bit to fit your needs. I'm going to drop another poll in. That is which county you are representing. We just want to get a feel for kind of where everybody is at. And then this will also be an opportunity. We'll have an opportunity later if you are comfortable dropping your email in the chat. That could be really useful. And that way people can connect with you based on their area. So Katie, that while you guys are filling out your, did the poll pop up? No? Oh, it says it's already launched in this meeting. Sorry. They've launched. Okay, it says a poll has been launched in this meeting. It must be the original poll. I apologize. I know this is super annoying. Stop sharing. Launch. There we go. Sorry about that. So I was going to say, while you guys are filling that out, yes, I really appreciate thinking of the little ones and their parents. Absolutely. Super important. Healthy parents are able to be there for their children in a way that unhealthy parents are not. So it's really, really important to focus on people's mental health from birth through, which is why Mental Health Association of Maryland has a bunch of different programs. We meet the needs of seniors as well as postpartum women after having children and postpartum people. So we're sort of across the lifespan with a variety of different programs to address mental health in all different communities. And also a huge amount of our direct service partners focus on mental health in different capacities, which is fantastic. So yes, we have resources, we have all of those pieces. But it's also a great conversation to start as we're talking about reducing stigma and getting adults to also talk about what's going on with them and how to reach out for help so they can be healthy for themselves and for the little people that they are in charge of. So we'll be sending resources. We also have a whole bunch of resources on our Children's Mental Health Matters website. So you can pull, we have like one-pagers on a variety of different conditions if you just are sort of looking for a place to start. If you are signed up for our newsletter, you will also get some resources there. You can be a champion and not be on our newsletter. So Angie's going to drop in the chat in a little bit our newsletter, so you can sign up for that. And just in case you are not receiving that, but you should be. Okay, so I'm going to end the poll and share results, and we can see where everybody is from. This also helps us figure out maybe where some of those gaps are in some of those counties so that we can check our list and make sure that we are covering all of the counties in Maryland. Shout out to the representatives from Charles County. Yes, our team is also spread across Maryland. So, you know, we do our best hitting folks. We also want you guys to let us know, some of you shared some great opportunities coming up where you've done awesome stuff in the past and are planning for the future. If you ever have larger events like that, we would love to come and support, to take photos, to help promote in whatever way. So you can always email us at the info at, I am definitely going to mess it up if I try to say it out loud, but we have an email address that will be dropped in the chat shortly that you guys can email us at and let us know when those events are happening. If you haven't already ordered supplies, because we would have it on our calendars if you ordered supplies. But if you're not ordering supplies, just let us know because we're happy to see if we can send a representative to help support. Okay, we are a couple minutes early. I don't think I have anything else I wanted to add. Angie, did I miss anything on our agenda?
I wanted to add that at some point we are going to be asking all of our champions to share events with us so we can keep track of them. And the mechanism for that, we're not completely sure what we're going to use this year. I think last year it was a Google Forms that a lot of people filled out, but we are going to be sending that out soon so that people, as you start doing them, you can enter those in. And what we would like is them, not like a bulk, hey, we're doing all of these things. We're hoping that we can get them entered in separately so that we can really get an idea for how many events are happening. So that would be something that will be coming soon as well. And I don't think, have we actually shared the link to the store yet?
I was just about to. I'm going to pop that link in the chat. We want your feedback. Tell us how you like those items. Also, you know, feel free to share other items that you think would be helpful for your campaign. And
Can you just share the page maybe? Can you share your screen maybe and share the page so we can look at it?
Windows up.
Huh?
Let me share the link.
Okay.
I have lots of windows. You don't want to see my screen.
Okay.
Here we go.
I'm really excited about the store. I know that we are going to be giving people things, but I know that so many people also then go buy their own things and it becomes a hassle and you have to do the proofing. And this just is one place where everybody can go and get materials that all look the same. They don't have to go through the process. Like everything's ready to go.
Yeah, it's a great opportunity also for schools. You know, all the teachers in a specific grade want to do some focus on children's mental health. They can all get matching hoodies or matching t-shirts to wear. and really stand out, take some great photos. And it just, it just adds to sort of this feeling of unity around the campaign that we're all working towards the same goals, particularly in the month of May, but all year round. And then we also, before we close out, we have a couple of webinars coming up. We do a monthly webinar series that goes all year long. And we have different mental health professionals that come and present with us and talk about a variety of different things. Tiffany was actually our presenter this past webinar, and it was wonderful. So if you know of any organizations that you think would be a good match, or anybody in your community that you would love to highlight, definitely have them email us at our page and let us know a little bit about what they do, or connect us, because we would love to highlight a variety of folks all around the state doing different things for mental health.
We are looking for something special to be our May webinar. If anyone has any great ideas that they'd love to share with us, I'd love to hear them. I can tell you that some of you might have participated in September. We have a webinar with Dr. Anthony Weiner, and he is going to be doing something in May virtually for the Office of Suicide Prevention. So he is coming back to Maryland to do that, or not actually coming back. We're doing something again in Maryland with him. So I know there was a lot of really positive feedback about his presentation, but he's coming back through a partnership with the Office of Suicide Prevention in May. Tiffany, do you have a hand up?
I did. I just want, oh, hold on. Oh, there we go. We're kind of sharing our, we're in the same room, so we want to make sure we didn't have any feedback, Carrie and I. I just wanted to share, like, so in addition to doing stuff for adolescents and youth and everything, we also provide presentations and support for educators in the area of mental health that they can also then take back to their students. So we've done a couple of presentations for Harford County Public Schools for the health teachers, professional development, like coping skills for the classroom and at home. And then on Friday, we just did a presentation for professional development for some high school teachers on mental wellness and the importance of emotional regulation. So with like Heidi asking, any ideas, we are really focusing a lot on education for not only the youth, but also their parents on what emotional regulation is and what it looks like and how we can predict what's happening in our bodies. And in the classes that we teach, we focus a lot on how does it feel? We do body mapping and saying like, where do these feelings feel in your body? So they can kind of have these predictors of how they're feeling and then how to kind of regulate themselves. So that's a big focus on kind of what we do. So I feel like that would be a really great topic to think about as far as like emotional regulation and what that is. So
right. Why don't you send us a summary of the things that you're doing those workshops on? I'd love to see those.
Okay.
And I'm sure Jess and Angie and Mackenzie would too.
All right.
I see in the chat oh, go ahead. Sorry.
Oh no, I was wrapping up. So if we missed something.
I see in the chat we've asked people to share about signing up. I wanted to make sure that schools understand that we want every individual school to sign up so that there's a contact in every school. So often a county board of ed will sign up, but then the schools don't actually get the information. So we want to make sure that schools are signing up individual schools as opposed to just the county school.
And I see Heidi responded to you, Katie. So yes, the events, we would love to have mental health specific events that are planned, but also if you have a back to school night or something else going on at your school, we also would love if you're able to have a table there and talk about children's mental health matters and those things. They don't always have to be specific. That, I mean, like ideally we would love to have more mental health focused events. But also we will fit in where we can to spread the word. So it's also fine if it happens to be a soccer game and they allow you to set up a table and talk to parents. That would be wonderful. Okay, I think we've dropped 100 million things in the chat. So thank you, Angie. All of these will be sent in an email, so don't stress about that. You will get a follow-up email that has all of this information and all of these links if you didn't capture them now. I encourage you to go and check out the store. I encourage you to fill out our Google form and let us know about events coming up that you're going to need materials for, so we can get those out to you as soon as possible. There's an option to either come and pick them up at our main office, or we can ship them out to you. So whichever works for you all. And I wanted to say thank you so much for joining
Can we
us.
get an
This was
update on the
fantastic.
poster as well? Because we got an update this morning. Can we, because the
Oh,
poster
sure. Angie,
contest is
did you want to share an
closed.
update on the poster?
Yes, so for the annual poster contest, we found out that we received over 100 entries from students. So we are really, really excited about that level of participation. And soon we'll be doing the hard work of whittling it down to a few finalists, so that poll and voting will be out. So we invite all of you and encourage you to jump in and weigh in and choose this month's poster. So that'll be coming in the coming weeks. We'll be sure to keep you informed about when that comes out.
And for those of you who have not been part of the campaign, Maryland Coalition of Families is the one that does the poster. So they go ahead and solicit entries for the poster contest from students who are making a poster about children's mental health. And then a winner is chosen. And then that poster actually gets printed as a poster and distributed. So you'll have an opportunity to receive one of those posters as well. So it's just a really fun thing that we do. And we've had, you know, all of them framed for the past 20 or so years that we've been doing this, which is just wonderful to see throughout the years. So thank you again so much for joining us. And I will see you guys. We have another rally coming up. We'll be able to share more ideas and talk a little bit more in, when is our next rally?
Next rally is April the 16th.
Thank you. On April 16th. Thank you all.
Wonderful. Thank you. Have a good one.
Thank you. Have a
Thank
great one.
you.